I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
And this was for the assessment I did on the GERD, right?
Yes.
Okay.
Wayne Allen is a well-developed and well-nourished 24-year-old male Caucasian who would be considered a young adult and whose central task, according to Erickson, is intimacy versus isolation. He has communicated his issues well during his head-to-toe assessment. He came to the ER today with a chief complaint of chest pain and some abdominal pain. When asked with introductions, Mr. Allen stated that he prefers to be called Wayne. He is a doctoral student in his last year at a local Christian university and stated that he has been dealing with even more than normal stress levels lately. In addition to being a full-time student, Wayne also works part-time at a local pharmacy. He lives alone in an apartment off campus, but still lives close to family and friends, who he says he enjoys visiting. He states he recently went out for a birthday dinner sponsored by his family. Wayne is 6'2" and weighs 190 pounds. His only allergy is to penicillin, and he is currently on no medications. His family medical history is significant, with his father and grandfather who have chronic GERD. His grandfather also has coronary artery disease with a stent placement, and his father has rheumatoid arthritis. His mother has also been diagnosed with GERD and has had her gallbladder removed for cholecystitis with a low ejection fraction. His past medical history is significant for recurrent otitis media as a young child, causing him to have tubes placed in his ears ×2. Within the past year, he noticed a yellowing of his sclera when dealing with increased stressors and was diagnosed with Gilbert's syndrome. Otherwise, he has no other health issues and denies any additional coronary risk factors of smoking, drinking, or taking recreational drugs. He has had all of his vaccinations, including the vaccine for meningitis, the vaccine regimen for HPV, and a flu shot. He stated that he is Baptist by faith, but has been unable to attend church services due to his other obligations. He states he is coping with this by reading his Bible every day. He stated his girlfriend of 7 years has recently broken up with him because he was too busy to spend time in their relationship. His coping is again effective, as he stated he's getting over it and is spending more time at the gym, where he works out 5 times a week, and also with family and friends. His physical head-to-toe assessment has been completed. His skin, hair, and nails were within normal limits, except that the toenail of his 4th phalange on his left foot has a black nail that he stated happens when he plays basketball. He is exhibiting some male pattern baldness, for which he shaves his head. His neuro check was within normal limits. The assessment of his head, ears, and nose were within normal limits as well. His respiratory system is normal, and his lung sounds are within normal limits, and his breathing is even and unlabored. His cardiovascular assessment is within normal limits, and his gait and muscle tone is good, but he does have bilateral flat feet. He states he drinks more than a gallon of water a day, which causes him to urinate more frequently. Otherwise, his urinary system is within normal limits. He stated that his bowels are acting regularly, and his pattern is generally every other day. As to his chief complaint, Wayne's 12-lead EKG and chest x-ray, as well as his blood tests, including troponin, CPKs, chem-comp, and amylase and lipase enzyme blood tests, were all within normal limits. His complete blood count, however, showed a slight elevation in his white blood cell count. Now I'm going to do a focused assessment. First, I'll wash my hands. Hi, Wayne.
Hi.
So I hear you're having some pain.
Yeah. I'm having some chest pain and I guess some abdominal pain. Kind of just all in this area here.
Just straight up and down?
Yeah.
What would you rate the pain? In other words, if you have no pain at a level of 0, or you're crying with pain at a level of 10, where would you rate the pain between that 0 and 10 on the scale?
Probably about a 5.
About a 5. Okay. Is this the worst it's ever been, or has it ever been worse?
No, this is the worst. I've been really stressed out. Probably the most I've been stressed out.
So you've noticed it more since you've had more stress?
Oh, yeah.
Okay. All right. So how long would you say that you've experienced the burning pain?
I've kind of always had this burning pain. Kind of fluctuates on and on. this for years, I'd say at least. But since my girlfriend broke up with me, and school's been really, really tough, and work's pressuring me to work more, it's been really bad.
Okay.
I thought today's was the worst.
Okay. Okay. All right. I'm just wondering, does your pain, you say it pretty much stays in this area, does it ever go anywhere else, to your back or to your arm? Or do you feel any other kind of pain besides burning?
No. I do have like nausea, and sometimes I'll throw up in the back of my mouth. But that's typically about it. But it's been the worst, yeah, by far, I think, today.
Okay. All right. So today's been the worst.
Yeah.
That's why you came to ER, huh?
Yeah.
All right. I'm going to take a look in the back of your throat first of all. Just see what I see. Okay. All right. I'm going to take a look in your mouth too. Open up, stick out that tongue. Here you go. Go. Ah. Yeah, your throat's red. Your mouth looks good. Okay. All right. Do you do anything that makes it worse? Is there any time that it's worse? For instance, when you go to bed, when you wake up, after you eat?
Yeah, a number of things. Typically, like when I work out, it gets pretty bad. Yeah, when I take a nap, or when I wake up, right before I go to bed, it's pretty bad too.
Okay.
Yeah.
Before you go to bed, what about when you wake up in the morning? How is it then?
Oh, it's pretty bad.
Pretty bad?
Yeah.
Okay, so it's just bothering you all the time, but those are especially
Those are the worst times.
stressful.
Yeah.
Okay. All right. Is there anything that you've taken or done that makes it feel better?
A while ago, I took, I think it was like Zantac and
For acid reflux?
yeah, and Tums. Yeah, but it was so bad today, I didn't think it was actually do anything. I was concerned.
Okay. All right. I was going to take a look at your belly, but first I want to ask you about your diet. How is your diet? Do you eat healthy? I know you're very busy, but do you eat healthy? Do you have more junk food? How does that go?
I typically eat late at night, and it's a lot of junk food. I don't have time to eat healthy right now.
Okay. Okay. I'm going to take a look at your abdomen if I may.
Okay.
And first thing I'll do is I'll listen to your belly sounds. Okay.
Okay.
All right. Just want to see how they sound. Now I'm just going to press on your belly, and if you tell me if there's anything that's especially painful about that. Can you do that?
Okay.
Anywhere? Okay. Okay. I'm going to press and I'm going to release. Press and release. Any pain with that?
No, nothing.
Okay. All right. All right. I'm just going to bring up your legs, just kind of. Any pain with that?
Mm-hmm.
Okay. 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 Is there anything else you want to share? I'm going to bring the doctor in just a few minutes, and I'll tell him all that you've told me.
Could I have maybe any young, cute, redheaded nurses check up on me too?
Well, I'll see what I can do. Let me go talk to the doctor about what's going on, and I'll see if I can find any young, cute, redheaded nurses for you, okay?
Blondes will settle.